When I came to CHKD to interview, it became very apparent to me that there was an energy that was pervasive and frankly palpable throughout the hospital.
I've always wanted to work with kids, and I remember driving by CHKD when I was little and telling my mom that I was going to work there eventually.
I came to CHKD to be part of a team. This team is focused on building the best possible care for children.
What brought me and what has kept me here at CHKD is a sense of belonging and purpose.
I chose to come and work at CHKD because I wanted to be part of such a committed, hardworking, dedicated team.
Growing up, CHKD was reputable in the community, providing great care, even to my own children. And I wanted to be a part of that leading healthcare system.
I just really appreciate the dedication that CHKD has to pediatric mental health. We see that with this new mental health hospital that's being built, and so the devotion to that I think is incredible.
Our hospital is going to be unique in nature throughout the state and our region because we're going to be able to take care of children with complex medical and psychiatric needs.
I am thrilled, excited, and hopeful about the mental health hospital that we're opening. Children will have quality mental health services, and that will help to create happier and healthier lives.
The mental health expansion here at CHKD is really building from the ground up. We don't have something that we are working from. We're starting a lot of things from scratch.
There's going to be a basketball court, there's a gymnasium, there's a music recording studio, there's art therapy that's going to be involved.
I am thrilled about CHKD's new mental health hospital. This hospital is actually more than a hospital. It's a mental health system. It's a really exciting opportunity to build a whole system of care.
I am fortunate enough to live fairly close to the hospital, and I love riding my bike to work. I've been able to do it year-round. In other places, I would not be able to do that, but here the weather is very good and allows that.
I love the museums, the great beaches, the beautiful weather. The people are wonderful.
From Virginia Beach having the oceanfront to Norfolk having the nightlife of Granby Street and Waterside District to the professional opportunities that it offers as well.
I just really appreciate all the parks and all the outdoor activities that Hampton Roads has to offer.
For myself and my family, this has just been a wonderful find, and we very much enjoy living in Hampton Roads.
My name's Debbie Oswalt. I'm the Executive Director of the Virginia Healthcare Foundation, and I'm here to sing the praises of Sentara Healthcare, a longtime partner and collaborator. Our mission is to increase access to primary health care for uninsured and medically underserved Virginians. The Healthcare Foundation has been partnering and collaborating with Sentara Healthcare for practically the whole 29 years of the Healthcare Foundation's existence. We have a common mission in wanting to ensure access to health care for all Virginians. So many of Virginia's mental health professionals are nearing retirement age, and the pipeline is not robust enough to replace them. And this is at a time when there's a greater need than ever for mental health services. And so at the Healthcare Foundation, we created a scholarship program to help increase the number of psychiatric nurse practitioners. I love that one of the key priorities that Sentara has identified for itself moving forward is increasing access to behavioral health services. That really speaks to the insights and wisdom of the Sentara leadership and understanding that mental health is integral to maintaining good physical health. Every time we have gone to Sentara with an idea, they have been a willing and engaged partner and collaborator.
Well, good afternoon. My name is Boone, and I have the pleasure of serving as the president of Sentara Virginia Beach General Hospital. I also serve as the executive sponsor for behavioral health services for Sentara Healthcare. and it is my privilege to introduce the final speaker for today's summit. Our closing keynote, Zuri Walker of Zuri Walker Coaching, is here to remind us that within each of us lies the power to influence change. But first, we must protect and support our personal behavioral health. For Zuri, transforming lives through coaching is her life's calling. Zuri began her career managing and supporting multi-million-dollar change management projects for corporate and government clients, including J.P. Morgan Chase, the Federal Aviation Administration, and the Department of Justice. Seeking to understand deeper, lasting transformation, Zuri studied transformational coaching in various holistic modalities with experts and masters from around the world. When not coaching, Zuri brings her unique insights on holistic living and transformation to others through her love of public speaking and hosting workshops. Zuri is passionate about helping individuals from all walks of life step into their purpose and greatness while living a life of balance, joy, and success. Welcome, Zuri Walker.
Thank you so much, Bernie, for that lovely introduction. And it is so wonderful to be with you all here today. I want to thank also Jennifer Wicker and the leadership at VHHA for hosting me. Thank you all. And before I get started into the presentation, I'm so happy we are able to do things virtually and safe, but it also means we aren't able to interact. And I do want to be able to have a chance to see and feel who's in the room. Let me just get so I'm going to be using the chat. Let me get a feel for how you all are. And if you want to just go ahead and chat, what is one takeaway? How has this conference been for you today? Any takeaways or insights with all of the amazing speakers that you've had thus far? All right, Lori says, awesome. Lori's having a great time today. Awesome. Joyce has had some insights. That's wonderful. And as you're doing that, I'm going to go ahead and share my screen. Had some good comedy at the beginning. Loved it. We definitely need some smiles and so forth. And yeah, there's been so many insights into some of the different interdisciplinary approaches. Thank you for that, Gayatri. And grateful, helpful. That's awesome. And I'm so thankful that there's something like this, these different sorts of conferences where we can be able to come together, learn from one another, gain greater insights in order to be able to bring that back into the world and into what we're doing. And yeah, Joellen, with being able to collaborate and so forth. And so I can understand what some of you all are coming from. Give me a chat in and tell me what sort of backgrounds are you all working from? Do we have therapists, physicians, others in the community? Got some nursing students. Awesome. Who else? Let me see who else we have here so I can see. Wonderful. Social workers, RNs, intervention, risk management, OBGYNs. I love it. I love it. Program administrators, therapists, private residential school. This is so good. It just fills my heart. And as a coach, I have worked with so many of you from all of those different professions, which is amazing. So my intent for our short time together is really to be able to serve you in a powerful and impactful way, not just to walk away inspired and refreshed, but for you to be able to have some personal actions that you can take for yourselves. How does that sound? So with that, I want to be able to dive in, and my ask for you today is that you not only are here with me and not just listening, but you are actually integrating and internalizing what I'm saying and thinking about that for you. So yes, love that you are excited with that. So I'm not going to spend a lot of time talking about me and all my background, but I do want to share, got some stuff for you to read on the screen, but I want to share a personal story with you about my journey and some of my experiences. And not many people actually know this. And yes, I got some family in there. Hi there. I love that, supporting me. Not many people know this, but I'm a U of R grad, so happy to be have done my schooling in Richmond. And my senior year, I hit a very deep space of depression. And it was a very, very challenging time in my life, so much so that I was not functioning. And if anyone, I'm sure many of you work with people with depression, may have suffered from depression yourselves. I couldn't get out of bed, was not going to classes, and it was really bad. And it was to the point where my mother, who's a psychiatric nurse, had to pick up and literally come and move in with me to help me through. And she was supporting me, not just as a practitioner, but a mother. And it was a profound experience where not only did I receive her help, but we literally had school officials worked with the dean of students, assistant dean, my professors, all over to really help support me and move me through this time, so that ultimately I was able to graduate and back and becoming a fully functioning and happy adult. But it was so profound to me to go through that. And for the reason, part of why I fell into such a deep depression was because I was alone. I was feeling myself in hiding. And a lot of things with mental health, we don't feel we can talk about, we don't feel we can even know what to do to get the type of help that we need. And that profound experience really taught me that it takes a village. It really takes a village to help move through some of the challenges that we go through, especially when we're talking about mental and behavioral health. And so the old African proverb, it takes a village to raise a child, I think is great, but it takes a village to care for a human. It takes a village to be able to move through and support one another in this, and especially in the pandemic that we're looking through. And so that's where I want to go today, in looking at the role that we all play, not for just, for others, but for each other and for ourselves, because we all play a powerful role in that. And so with that, because as you know, where I'm going here is to talk about you and what do you need and how can you get and support you. I really believe that the next frontier of behavioral health has three components of it. First of all, is normalized, where it's no longer a stigma to be able to get help. It's no longer a stigma even to suffer from things. Once upon a time, it's becoming a little bit more normalized, even to say I'm suffering from depression, or to say I dealt with this. There was such a stigma of judgment that we had around that. And so to be able to shift around that, and especially not just overall, where behavioral health can become more mainstream just as a part of an integral part of overall health, but that as healthcare providers and all the different pieces of behavioral health, that that you can and should and get the help and support you need. And that's where I get to as well with it's integrated, where it is an integrated community of providers, recipients, and supporters, and we rotate in those roles. And lastly, I think it's so important that a critical standard piece of behavioral health has to become resuscitative, that we actively as providers care for each other in order to give and receive the help that's needed. And as we go, if things are resonating and so forth, feel free, please use the chat so I can see what's landing for you and what's resonating for you. And so when we're talking about normalize, I'm going to share another really personal piece with that. Last year and the beginning of this year, I really dealt with some challenging things and experienced that someone very dear to me and a loved one was dealing with addiction. And it was so challenging for me. And I found I was really scared and frightened about this for this person that I love. And I also felt such guilt for myself about how did this happen? How did I let this happen? Although this was a complete individual and adult human, but there was this shame that I had as a coach, as a practitioner, as an expert in wellness who works in this. How could I have someone close to me battling this? And in that shame, I found myself hiding, and I found myself really struggling with that and not getting the help and support that I need. And so I say this because I know so many of us, we are also humans. You're not just providers, but you're humans dealing with real life and real life circumstances, especially in this pandemic. And the things can be challenging and it is tough. And I had to do my own work and do tools, one of which I'm going to teach you today, about how do I move through this? How can I get the help that I need? How can I actually get the support that I need and be willing to actually ask for it? And I want you to think about for yourself, because we often have the identity of provider or the piece of that healthcare, but am I willing to actually move through any of those stigmas or fears to get and receive what I am dealing with? Now, I know a lot, especially those of you, because you have your licensed professionals and there's licensure that can be of concern, but there is help. And I love, you're at the conference, you saw all sorts of some of the resources that are out there for you to know that you can get the help and support that you need. And so that's that next piece as a integrated form of behavioral health, where I feel that we really need to move from being not just a provider, but to a recipient and supporter, that we've got to rotate between all through. It's standardized. If you're a physician, you know that not only are you giving physical care to others, but you still go in, I hope, for your checkups, right? You still know that you've got to go in and at sometimes be the patient, be the recipient of care. But for some reason, sometimes we don't necessarily do that for ourselves. And I really want to just hone in and emphasize how important that is for you to give. Why isn't standardized that we do regular check-ins with therapists or a coach for ourselves? Why is it that in so many ways, behavioral health does not kick in for many until you've gotten to the point of problem where there is nothing else? Why isn't it something where we can't just do it as a standard form of help and support for ourselves? There's preventative care from physical. We need preventative care for our mental health as well. And so I really want to stress that we've got to look at integrating that for ourselves. And with that, to be able to see that self-care isn't selfish. It's needed. And it is so, so critical on that. Yes, I'm glad you're feeling me with that, Vincent. And if you doubted that or ever wondered, I did some research when I was looking into this, and there's all sorts of studies that have looked at healthcare workers and the impact of the pandemic. And I was really just floored. And a study that the CDC put out just a few months ago showed that out of thousands, 53% of interviewed, 53% of healthcare workers reported symptoms of at least one mental health issue from the past 2 weeks. So this wasn't even studying like what you may have gone through over the past year and a half. It's just in the 2 weeks that they went and surveyed, more than half of the people experienced some sort of mental health issue of the providers. PTSD, depression, anxiety, even suicidal ideation. This is deep. So no one is alone on this, that we are all dealing with some sort of struggle. And I'm going to just read a couple of things of some of the other symptoms that people talked about experiencing. And if you resonate with this, either for yourself or you know someone who's dealing with this, I want you just to type a yes as I type some of these things. These are the things that providers, healthcare workers are dealing with. Stressed out and stretched too thin. Experiencing anxiety, feelings of frustration, exhaustion and burnout, overwhelm, trouble with sleep, work-related dread, changes in appetite. I'm going to stop. The list goes on, but just look at this, like the yeses, the yeses, the yeses. We are all in this, and this now is the time for you to care for yourself, to give yourself that need. And so I'm going to take you through, if you will, I'm going to teach you one simple process that you can get for yourself. Now, there's bigger help that I want to encourage you to go, but we also need to just start caring for ourselves at a deeper level. So are you with me? I'm going to take us through a quick, just 90-second process. And I would love for you to do this, because even these 90 seconds is going to be impactful for yourself. So go ahead, and I'm going to do it with you. And we're going to just push yourself back from your desk a little bit and sit comfortably in your chair and close your eyes. And if you're like, yes, I'm just going to watch, go ahead and join me though. Close your eyes, and I invite you to place your right hand over your heart center and your left hand over your belly. And take a moment and just breathe. Take a moment and just take a deep breath in, feeling yourself slowing down, giving yourself permission to take this moment for yourself. And I want you to send yourself some love and gratitude for yourself. Just accepting how amazing you are in all the things that you do. And giving yourself permission just to feel that. And as you feel yourself continuing to settle in, ask yourself, in this moment, in this time in my life, what do I really need? What would serve and support me most right now? And just allow that answer to bubble up for yourself. And feel that, whether it's something big or little, whether it's something as simple as more time, a break, some support, and feeling, what one action can I take for myself that would feel amazing, that would be resuscitative and rejuvenating for myself. And taking in a final deep breath and just opening your eyes. And let me ask, how was that experience? Anyone, how are you feeling right now, even just after taking a minute of breathing, after just giving yourself a few seconds? All right, serene, relaxing, lighter. I love it. It's amazing for my private clients and my groups. They're like, oh my gosh, Zuri, the only times I get to truly breathe and resuscitate are when you guide us through these deeper meditations. Yeah, Julie needed a minute. That's wonderful. These are opportunities that are out for you. And I invite you that you can keep doing this for yourself, to carve out time every single day. And yes, because sometimes we do have so much going on, but you've got to give yourself permission to clear. You know what it's like? It's like, you ever have it when your laptop or phone just stopped working well? And you have to get reminded, and sometimes it gets so bad, you got to call the tech and get reminded. When is the last time you actually turned it off? When is the last time you closed out all of the apps and let it refresh? The same goes for you, except we need to do that on a daily basis, because your help is needed. What you all are doing is so powerful and is so impact and truly is supporting and shifting the world that we live in with all of the people who are struggling. But remember, your health is needed in order for you to be able to do that. The two go hand in hand. And it is imperative for you to be willing to resuscitate. And sometimes it is a fight to be able to put yourself forward, to be able to get what you need when you need it. But if you're not filling your cup back up, that means there's just less and less in the cup to be able to give to others. And so with that, I want to send you some big love because the help is out there. I want to encourage you to continue making time for yourself, that it is possible, and to continue to heal and be healthy and get the help that you need, whether it's even making some time for yourself or going out and getting some of the formal help. So with that, it has been wonderful interacting. I'm so glad we got a chance to go and dive in really quickly. I put up my info. I would love to hear from you if you've got questions or want to interact. My website, email address, and I actually have a self-care starter kit. If you know you need to go and take some more time for yourself, go to my website. It's a pop-up and download the starter kit so you can really look at and experience so much more of what is there for you. And so with that, thank you so much. And thank you so much for hearing from all of you. And with that, I'm going to go ahead and pass it over to Kurt to close us out for today.
Thank you so much, Zuri. I just deeply benefited myself from that. Looks like everyone else did as well. It's such a great way to end such a wonderful day. Thank you for all the participants. Thank you for being here for our 2021 VHHA Behavioral Health Summit. It is quite a day and time in our lives. The challenges caused by COVID-19 are not behind us, but there is hope for a brighter future in our Commonwealth. And with all of you at the helm, I know that we will accomplish great things. The health of so many people depend upon that. I want to take a moment to thank our outstanding presenters, including Zuri and many others, our generous sponsors, and most importantly, each and every one of you. Thank you for choosing to spend your day with us today. I hope that you leave today energized and ready to forge ahead with new ideas and partnerships. This is a great networking opportunity. Change is possible, but we can't do it alone. It takes our collective knowledge, resources, and energy, and there is an abundance of that in the room, or in the virtual room, I should say, today. So before we sign off, I have one final request. Please complete the Summit feedback survey to help us improve for next year, which hopefully we will be able to do in person. You can access it in the virtual lobby of this event or in the post-session attendee email that you'll receive. As a reminder, today's sessions were recorded and will be available in the webcast auditorium of our virtual platform for 30 days. And you will also receive a post-summit email with instructions related to that. So once again, thank you all so much and enjoy the rest of your day.